Good afternoon, everyone. It's my pleasure to welcome you to the 2020 David C. Jowers Lecture, hosted by our Nell Hudson Woodruff School of Nursing. This year, the format is a bit different. I'm sure you've noticed already. It is held in this space that has become familiar to all of us during this pandemic, the Zoom space. And today's event is held as a webinar. So while it's not our usual format, we are hopeful that this allows more of our nursing community to join us from across the globe. We have a number of students who are not in Atlanta specifically, alumni, and others who are with us today, so welcome. Today's event will also follow a slightly different format than previous years if you have been a previous Jowers lecture attendee. And the lecture and the speakers later today are being recorded and will be available through the Emory Nursing Experience for continuing education credit. My name is Carolyn Clevenger. I'm Associate Dean for Clinical and Community Partnerships at the School of Nursing, and I have the privilege of moderating today's event. Our agenda includes a lineup of a number of speakers, beginning with a welcome from Emory University President Greg Finvis, and an introduction of today's lecture by Dean Linda McCauley. Following that, Dr. Ernest Grant will deliver the 2020 David C. Jowers Lecture, and his lecture will be followed by three panelists, Dr. Tim Cunningham, Dr. Jeannie Cimiotti, and alumnus Ms. Kiah Ford. Following their remarks, we'll have time for question and answer, and I actually invite you to submit questions and answers through that feature in the Zoom throughout the day. Now let us begin. This year, President Gregory Finvis became Emory University's 21st president, and what a year to join us here at Emory. President Finvis comes to us from a notable career of academic leadership at the University of Texas in Austin, where he helped raise the university's retention and four-year graduation rates to record levels by spearheading innovative student success programs, increasing resources for students, increasing funding opportunities for faculty. President Finvis is a civil engineer by training. He's also been recognized in his field for his groundbreaking research in earthquake engineering and academic leadership with numerous national awards, and was elected to the National Academy of Engineering in 2014. Also of note to us, this is President Finvis' first official opportunity to meet our Emory nursing community, and I'm thrilled to welcome him to the Zoom stage. President Finvis, the mic is all yours.
All right, thank you, Carolyn, and good afternoon, everybody. So I have been at Emory now about 2 months, and this is my first visit to the Nell Hudson Woodruff School of Nursing, and I know it won't be my last, and I hope in future meetings I actually get to see you all and have a chance to meet. But it's also, I'm very pleased to welcome so many members of the Emory healthcare nursing team here. And I want to say a few words about the collaboration between the School of Nursing and Emory Healthcare. But one of my the first things I wanted to do when I got to Emory was go over to Emory University Hospital and just see and thank the frontline healthcare workers and many nurses and members of the nursing staff for the incredible work that you've been doing under very difficult conditions, very trying circumstances. And I hope to get out to the other hospitals and facilities for Emory Healthcare to do the same, because you really are the heroes of what this university and what Emory Healthcare has done to take the lead in caring for members of this community with this terrible pandemic. And that is the lesson I've learned very quickly, is how Emory has come together. And I especially want to recognize the School of Nursing and Dean McCauley, who I'll introduce shortly, for the leadership that you've stood up to recognize that under these times and in these conditions, we need to rethink the delivery of healthcare. We need to think how we work together across the professions, interdisciplinary approaches, not only for clinical care, but let's address some of the underlying issues and some of the underlying problems so that we can improve medical care and the treatment of patients. And nursing is at the so much at the center of how we do that, and so vital to healthcare for our patients and for their families. And I know so many of you have been in the rooms, in the ICU units, holding the hands of patients who can't see their family members because of the pandemic. You are literally their lifelines, not only to compassionate care, but being compassionate yourself in dealing with the personal situations. And then we have to look across society. What is this pandemic telling us about our society and the delivery of healthcare? And what an important time to have this special lecture by Dr. Ernest Grant, because we are seeing through the filter of COVID-19 the health disparities that we have known exist in our society and exist in our cities. But this is shining a very bright light on individuals and families and communities who are suffering. The disparate impact of this disease is truly stunning. And this sets important questions, establishes important questions of how we move forward as a society, as a healthcare profession, and the research agenda that we are going to need to pursue so we can begin to address these fundamental problems in healthcare that are reflecting fundamental problems in society. And finally, I want to thank the Jowers family. As I learn more about Emory, I've come to understand the family's steadfast servant leadership has had a lasting influence on the Nell Hodgson Woodruff School of Nursing. And I understand Ronnie Jowers is somewhere in this audience, although I can't see you. I've heard that he is going to be participating in today's special Jowers lecture. So with that, I'll conclude. And now it's my pleasure to welcome one of the most dynamic and successful deans at Emory University, Dean Linda McCauley.
Thank you so much, President. It's so wonderful to have you here with us. The nursing community were so anxious to get to see you, and what a great opportunity to hear your words about the importance of nursing and hopefully to forge a partnership that will continue on in the future between the School of Nursing and the President's office. So the event that we're celebrating today is a forum for engaging students and faculty and healthcare providers in the community in thoughtful discussions focused on the very important role that nurses play in achieving quality, safer care, advancing compassionate support, treatment, and the care of individuals and families. And just as President Vindez said, never has it been so profoundly demonstrated than during this COVID-19 crisis that we're working through. This lecture series is supported by the generous endowment established in Mr. Jowers' memory by his family and his beloved friend and partner, Tom Roussard. Their support enables us to engage every year the nation's best and brightest leaders, practitioners, and researchers to share their knowledge and perspectives on emerging issues in healthcare. This lecture was established to honor David's spirit and memory. He's left quite a legacy of leadership and service to others. He cared deeply about people, and he cared about the environment in which all of us live. And his caring was expressed through his work and his love for nature. And he was a corporate leader, and in his leadership role, he inspired and encouraged and touched the lives of many people. But it is his book, A Traveler's Guide to the North Georgia Mountains, that connected him to countless others who found, as he did, a passion, joy, and healing in nature. So caring, the art and science of improving well-beings of others, is what lies at the center of this lectureship. And so each year, as we choose who to invite to give this lecture, we look for people who represent the best that nurses do in terms of caring. And caring is what distinguishes us from others who simply provide a service. David Jowers, his family, and others that were close to him remind us each year of the importance of caring, and it gives us a unique opportunity to learn, reflect, and rededicate ourselves to the nursing profession and to those we serve. Among those closest to David were his parents, Edna and Marvin Jowers, and his sister, Emily Jowers, his brother, John Jowers, his cousin, Ronnie Jowers, who worked for Emory for a long time, and his very dear friends, Whitney and Greg Rousseau, who I think they are with us today. And I think that Tom is joining us, his beloved friend, for the lecture today too. It's now my pleasure to introduce you to today's speaker, the president of the American Nurses Association, Dr. Ernest Grant. And one of his dear friends, Jill Hamilton, is on our faculty. And when Jill came back to us from being in Chapel Hill, all she wanted me to do is give Dr. Grant a chance to visit Emory and share his wisdom with us. And so I'm very pleased to have him here with us today. He's so distinguished, 30 years of nursing experience, and an internationally recognized burn care and fire safety expert. What a unique background. He previously served as the Burn Outreach Coordinator for the North Carolina J.C. Burn Center at the University of North Carolina Hospitals at Chapel Hill. And in this role, Dr. Grant oversaw burn education for physicians, nurses, and other allied healthcare personnel, and ran the center's nationally acclaimed burn prevention program, which promotes safety and works to reduce burn-related injuries through public education and legislative process. Dr. Grant also serves as an adjunct faculty for the UNC Chapel Hill School of Nursing, where he works with undergraduate and graduate nursing students in classroom and clinical settings. Dr. Grant is frequently sought out for his expertise as a clinician and educator. In addition to being a prolific speaker, he's conducted numerous burn education courses and actually worked in preparing troops for deployment to Iraq and Afghanistan, and how to manage and to prevent and manage burns in the theater of operations. And in 2002, President George W. Bush presented him with a Nurse of the Year award for his work treating burn victims from the World Trade Center site after the attacks on September 11th. In 2013, he received the B.T. Fowler Lifetime Achievement Award from the North Carolina Fire and Life Safety Education Council for making a difference in preventing the devastating effects of fire and burn injuries and deaths within the state. What a remarkable professional calling. And along with his very significant work in burn prevention and treatment, he's an active participant in professional organizations. He was the past chair of the National Fire Protection Association Board of Directors and served as second vice president of the American Burn Association Board of Trustees. He also holds membership in Sigma Theta Tau and Chi Eta Phi. His BSN degree was from North Carolina Central University, and his MSN and PhD degrees from the University of North Carolina at Greensboro. In 2014, he was inducted as a fellow into the American Academy of Nursing, and he is also the first man to be elected to the office of President of the American Nurses Association. So now it is my greatest pleasure to turn the program over to Dr. Grant for his lecture entitled Care of Vulnerable Populations, Focusing on Pandemic Responses and Social Injustices. Thank you, Dr. Grant.
Thank you, Dean McCauley, and good afternoon, everyone. It's indeed a pleasure to speak to you today. I want to also give my regards to President Fenves, members of the Jowers family that may be listening, to the faculty and the students. I can't tell you what a joy it has been today to have some very energizing discussions with members of the faculty, students, also the chief nursing officers of the Emory healthcare system as well. I thank all of you for the opportunity to present to you today the Jowers lecture, and look forward to some robust conversation after the presentation. So with that said, let's get started. So Steve, if you will give the first slide, please. As was mentioned, I am from the American Nurses Association, but I want to talk a little bit about what is so important about caring for vulnerable populations. Obviously, this lecture today, what I wanted to focus on is right now the most vulnerable population are our nurses and other members of the frontline team who are caring for patients in as a result of COVID or in very vulnerable populations as well. So I'll talk a little bit more about that as we go through. But when we talk about vulnerable populations, obviously we're also talking about the public as well. But I think that our nurses are also at that vulnerability, and we'll talk more about that during the presentation. Next slide, please. So some of you may have heard of the American Nurses Association, or sometimes you may hear the ANA Enterprise, and you may be wondering, well, what it is that we're referring to. Well, ANA is actually composed of three specific organizations. There's the American Nurses Association, the American Nurses Foundation, and the American Nurses Credentialing Center. All three of these organizations work together as a cohesive system to achieve the enterprise vision and advance our mission and embody the enterprise value. So our vision is a healthy world through the power of nursing, and our mission is to lead the profession to shape the future of healthcare and nursing. So by leveraging each of these different drives and specialties that are listed there, we're able to achieve that success. Next slide, please. So just a few words about the ANA. We are the premier organization that represents all registered nurses in the United States, of which right now the official count is 4.3 million registered nurses. We're at the forefront of improving quality of care for all, and our core function is achieved through advocacy and professional development. As far as ANA membership, our strongest gains in the past few years has put us in the top 9% of associations for membership growth. In fact, according to a national benchmarking study, ANA is the #1 fastest growing large association among individual member associations over the past 5 years. In fact, we've continued to experience membership growth during the past few months as we've worked very, very hard to understand and respond to the needs of nurses during this pandemic. Now, of course, we can't do that without the help of our 50 constituent and state nurses association, of which I'm proud to say that the Georgia Nurses Association is a part of that. And we also partner with 38 organizational affiliates to speak as one strong voice for the profession. Next slide, please. As you know, nurses are the largest health profession, and we also spend the most time with our patients. And I'm proud to say that for the 18th consecutive year, the public has ranked nursing as the most trusted profession in Gallup's annual Honesty and Ethics poll. The Gallup organization, as you know, asks the public to rate a wide range of professions on honesty and ethics, and by a wide margin, nursing was the most highly rated. Patients obviously rely on nurses to advocate for and improve healthcare policy, practice, and care. And as I mentioned, This presentation will focus on what it is that we're doing to address vulnerable populations, that being not only nursing, but also the public's health as well. Next slide, please. So 2020, as you know, started out officially designated as the year of the nurse and midwife in honor to celebrate the 200th anniversary of the birth of Florence Nightingale, the mother of modern day nursing. So the World Health Organization officially designated 2020 as the year of the nurse and midwife. It is significant for WHO in that context that nursing and midwifery strengthens universal health coverage. So the WHO notes that the midwife and nurses are essential to the achievement for universal health coverage. So when the ANA Enterprise began planning to celebrate the year of the nurse and midwife, little did we know that we would be in the grips of a global pandemic. Now more than ever, we need to support and recognize nurses for their contributions in crisis and for their ongoing role in meeting the needs of patients and their communities. And we're reminded just how apropos the Year of the Nurse banner really is. That is to excel, to lead, and to innovate, because we have done all of those meeting the challenge that has faced us as a result of this pandemic. So our goal for the Year of the Nurse has always been to recognize all nurses as they excel, lead, and innovate wherever they practice. Next slide, please. So while not what we expected, this year is transforming the nursing profession and elevating nursing's role on the healthcare team in the eyes of the consumer. The ANA Enterprise is committed to informing and supporting nurses during the coronavirus pandemic. We're listening and we are responding. To gain a better understanding of the frontline nurses' needs, we conducted a comprehensive survey in late March. Based on the responses of more than 32,000 nurses across the nation, we gained some clarity about their top needs, and specifically the top three that we found in this first initial survey was that there is an extreme shortage of PPE, or personal protective equipment. Nurses felt ill-prepared to care for the COVID patients. They even did not quite understand what was their role or their expected role in looking at their facilities' emergency operations plans. They knew they were a part of it, but they didn't know what specifically their role would be, particularly since COVID affected all aspects of the acute care setting, not just the ICU or the emergency setting, but all over, obviously. And then the third thing was the fear of cross-contamination and safety of their loved ones. So as a result of getting that survey, and by the way, we have done surveys of nurses every other month, and we'll talk a little bit more about what has happened as a result of those. But during this initial survey from March, we launched a COVID-19 webpage in February, offering CDC and other important links early in the pandemic. Informed by the findings of our survey, we also expanded and refreshed the website in April. We also created the Resource Center that houses the latest information pertinent to both nurses and consumers. It has things like frequently asked questions, educational resources for nurses, ANA's advocacy efforts, and nurses' stories, and it also has a section on honoring our fallen nurse heroes as well. Next slide, please. So one of the things that we had to do, obviously, was address the shortage of the PPE, particularly the N95 mask. So collecting data from nurses about their experiences on the front line has been and will continue to be a priority for ANA and for our foundation. So we've done a variety of surveys, as I stated earlier, beginning in March, with a comprehensive survey of nurses' experience on the front line. And through that, we learned about the critical shortage of PPEs. And since then, we have conducted two other pulse surveys, if you will, that focused on PPEs, one in May and another one recently in August. Sadly, and of great concern, 6 months, might as well say now 7 months in, with more than 6 million cases of COVID, the findings revealed that persistent gaps in access to critical PPE, as well as nurses' concerns regarding the reuse and decontamination process. So according to the findings that we found, 42% of the nurses say that they are still experiencing widespread or intermittent PPE shortages. Over half of the nurses, and this was up 15% from the May survey that we did, reported that they were reusing single-use or PPEs like the N95 mask for 5 or more days. 68% said reuse is required by their facilities, and the decontamination of the N95 mask is a standard practice in about 38% of what nurses reported. So in accordance with the CDC, the ANA does not support the use of decontamination methods as a standard practice. We understand that this is a crisis and we have to make do with what we can. But these masks were, as you know, initially designed to be used once and discarded, but because of the shortage, you know, we do understand about the need for re-sterilization and redistribution. Next slide, please. Our foundation also launched a series of surveys as well. And the first one focused on the mental health of nurses. And we found after having nearly 10,000 nurses to take this survey, half said that they continued to feel overwhelmed. Nearly 30% say they were experiencing feelings of depression. 3 out of 4 of the nurses who responded say they were suffering from challenges with sleep, either excessive sleep or sleeplessness. And then earlier this month, in September, we released the findings from a survey about financial wellness. And more than 1/3 of all the respondents reported delaying major purchases, or findings from the survey also showed that Black and Hispanic or Latino nurses were more likely to have offset financial challenges. Some of the addressed financial challenges by Black, Hispanics, and white, one, as far as accessing savings, 44% of the Black respondents reported that they did that. 47% of the Hispanic or Latino respondents reported that, and 38% of the white respondents stated that they had to access their savings. As far as with stopping payments on student loans, 38% of the Black respondents, 30% of the Hispanic respondents, and 22% of the white respondents reported that. Borrowing from friends or family, again, 17% of the Black nurses respondents, 10% of the Hispanic or Latino, and 7% of the white. And then receiving assistance from charity, including like a food bank, 9% of the Black respondents, 6% of the Hispanic, Latino, and 2% of the white respondents was there. So as you can see, COVID-19 is affecting all aspects of our lives, even down to the financial challenges that nurses are meeting. Also, from this particular survey of particular interest was that Black and Hispanic or Latino nurses were also more likely to be in roles providing direct care to COVID-19 patients, while white nurses, or 58% of Blacks reported that, 63% of Hispanic nurses and 49% of white nurses reported that, and they were twice as likely to have been diagnosed with COVID-19 also as a result of you know, the work that they were doing. Next slide, please. So based on our survey findings, the American Nurses Association developed a series of free webinars to address the need for education on COVID-19. Thus far, we have 7 webinars to cover a variety of critical topics. These are things that nurses felt that they needed in order to provide care for the COVID patients. So they included a lot of core information on, one, PPEs, how to properly don and doff the mask, ventilator training for the non-ICU nurse, ethical challenges that COVID-19 has forced on nurses, mental health resources, the racial disparities brought on by COVID-19, ambulatory APRN care, and the progression of COVID-19. So these webinars are free for all, and there's almost 6 total hours of free continuing education credits that you can get, and they can be viewed on demand. All you need to do is go to nursingworld.org and register and take those. we've seen some extraordinary success with this engagement with these webinars. Already, there's more than 155,000 nurses who have registered for the almost 300,000 have taken the webinar. So we're extremely happy that this is meeting a need that is out there for this very vulnerable population. And we're going to continue to evaluate and add additional webinars on topics as the pandemic continues to move forward. Next slide, please. Another thing that we were able to do as well is the American Nurses Foundation launched the Coronavirus Response Recovery Fund for nurses to enable the public to support and thank nurses. The National Fund was created to address and identify emerging needs of nurses and also focused on a number of things. First, it provided direct financial assistance to nurses. You know, nurses who may have been laid off or furloughed that were living paycheck to paycheck. They were able to get a one-time $3,000 payment to help them meet expenses such as mortgage or put food on the table or pay some other bills that they may have. Supporting the mental health of nurses today and in the future, and we'll talk a little bit more about a mental health program that we put together in just a moment. Ensuring that nurses everywhere have access to the latest scientific-based information to protect themselves, prevent infection, and care for those who are in need. And then finally, we also, this fund is driving the national advocacy focused on nurses and the patients. The effort kicked off with a $1.9 million support sponsorship grant from Johnson & Johnson and also Tylenol, Neutrogena, Johnson & Johnson's Aveeno brand. And together we encourage like-minded organizations to and individuals to also help participate with this. So far we've raised a little over $10.5 million has been raised to date. And of course, if you or the public would like to contribute to that fund, you can text thanks to 20222 and you can make a $10 donation to the COVID Response Recovery Fund for nurses, or you can make an online contribution by going to www.thanksnurses.org. Next slide, please. Now, as I stated, the other thing that the foundation did during one of its survey was to find out, obviously, as the extraordinary stresses confronting nurses during the coronavirus pandemic began to take its toll on the mental health and well-being of nurses, nurses needed some sort of an authentic support system and tool. You know, as members of the healthcare team, sometimes we don't like to admit that we may be under a lot of stress, emotional stress, strain, and et cetera. But as the pandemic continues to compound the day-to-day stresses that nurses were experiencing, also not only that, but given the surge in patient numbers and other issues surrounding access to personal protective equipment, the anxieties about, am I possibly bringing this virus home to my family? What about my personal health? The ethics and moral conflict as well. All during these unprecedented times of fear and stress, nurses are at high risk for mental health issues as well. Things like anxiety, depression, and of course, post-traumatic stress issues as well. Next slide, please. So we had more than 200,000 nurses are estimated to have been suffering from PTSD as a result of this work, and we anticipate that number to grow. So as a result of that, the American Nurses Foundation, the ANA, and we also partnered with the American Association of Critical Care Nurses, the Association of Perioperative Registered Nurses, the American Psychiatric Nurses Association, and the Emergency Nurses Association. We launched in May this National Well-Being Initiative, and it is designed specifically for nurses by nurses across the United States. This comprehensive mental health well-being program includes vital support systems and a digital toolkit to support the near and long-term needs of nurses' mental health. These resources will help nurses build resilience and take necessary steps to manage the stress and also overcome the trauma caused by COVID-19. And I know that we're going to be talking about resilience a little bit later on during our panel discussion, but I'd like to share with you just some of the components of this particular program. First of all, there's a stress release assessment. There are 10 anonymous questions for nurses to take to check their stress level and get suggestions for tailored resources that will be able to help them to get and to stay in balance. There's a section called Nurses Together, Connecting Through Conversation. And what this does, it facilitates nurse-to-nurse video calls that provide a safe space to talk openly about the self-care and wellness, recovery and resilience, care dilemmas, bereavement, and more. It's an opportunity for nurses to just listen to other people who have walked a mile in your shoes so they have an understanding of what it is that you're talking about. There's the ModFit mobile app. This supports nurses' overall wellness by allowing them to set personal goals related to exercise, nutrition, sleep, mindfulness, to track their own progress and also set up convenient activity reminders as well. And then there's the Happy app. The Happy app is for nurses who want to talk with a supportive person. The Happy app provides free 24/7 one-on-one conversation with support giver team members from the comfort and privacy of your own home. The first call for all the nurses is complimentary, and that's made possible by the American Nurses Foundation. And then there's a narrative about expressive writing. We have found that sometimes just writing out your frustration works very, very well as well. So there is help to process nurses' experiences related to COVID-19. There's a 5-week guided narrative expressive writing program. Participants are invited to respond anonymously to weekly prompts that are reviewed and responded by trained professionals. But again, it's a way for them to express their feelings and put it on paper and perhaps review it a little bit later on. And then there's mental health support services as well. And what this does is it uses the Nurses Guide to Mental Health Support Services, helps them to better understand what support systems and services are available for nurses and how they can locate them, from peer support all the way through to anonymous ways to find mental health care providers as well. You know, as nurses, again, sometimes it's difficult for us to admit that we need help, but this is another way to try to help meet that need. Next slide, please. So I've talked a little bit about the vulnerability, if you will, that that nurses have experienced as a result of the COVID crisis. But I also would like to tell a little bit about what we at ANA have been doing to try to help alleviate that as well. So we'll take a few minutes to talk about advocacy and leadership and what we have been doing. So next slide, please. As you may or may not know, ANA has a very rich history of legacy, if you will, of advocacy for more than 120 years. We've advocated for things like women's suffrage, to standards for education and practice, to supporting legislation for Medicare, to protecting economic and general welfare, to shepherding the code of ethics with interpreted statements, to codifying our social policy statement, to creating a nurses credentialing agenda for the nation. We have been serving nurses, the public, and the profession. Just point out some historical moments on the slide here. On the left is past ANA President Jo Eleanor Elliott as she's shaking hand with then President Johnson at the signing of the Public Health Service Act. And in the middle is past President Karen Daly with President Bill Clinton. That's in 2000 at the signing of the Needle Stick Safety and Prevention Act. And then I have no idea who that handsome guy is with George Bush, but he's being recognized for his work with the victims from the 9/11 bombing that had occurred in New York. So we have a very, very long history of doing a great deal of advocacy, and we'll talk a little bit more. Next slide, please. So as I said, we have long been vocal advocates on Capitol Hill also for ensuring access to high quality, affordable health care. ANA uses these 4 principles that you see here: access, cost, quality, and workforce to evaluate any healthcare reform legislation that may come along. We have to, we use these 4 points. One, it has to ensure that universal access to a standard package of essential healthcare services for all citizens and residents, not just a few, but for all citizens and residents. We want to optimize primary community-based and preventive services while supporting cost-effective use of innovation, technology-driven acute hospital-based services. We want to encourage mechanism to stimulate economical use of healthcare services while supporting those who do not have the means to share in the cost. And finally, we want to ensure that there's a sufficient supply of skilled workforce dedicated to providing the high quality healthcare services that are needed as well. Next slide, please. Some of the ways that we do that, obviously, is advocacy is through our code of ethics, and it is in the code of ethics. And here, advocacy is defined as the act or process of pleading for, supporting, or recommending a cause or course of action. ANA believes that advocacy is a pillar of nursing. Nurses instinctively advocate for our patients in the workplace and in our communities, but legislative and political advocacy is no less important to advancing the profession and patient care. And that's one of the big focuses that we've been trying to encourage nurses to become more politically active as well. Next slide, please. So as COVID-19 has come to the shores of America, and some of the advocacy that we've been doing from the legislative front, we'll talk a little bit about those. First of all, we've partnered with the American Medical Association and the American Hospital Association to do a Wear a Mask campaign. And we've also partnered on a wide range of other advocacy efforts as well, including writing joint letters to the administration and to congressional leaders. And as I stated, most recently, we collaborated on a comprehensive collaborative campaign that included public service announcements urging the American public to take the 3 simple steps to help stop the spread of COVID-19 by wearing a mask, practicing physical distancing, and also washing your hands frequently. Along with that, we have also advocated for a CDC education grant. The CDC invited ANA to partner on an initiative to convene subject matter experts to refine existing guidance on infection control and prevention. And the goal of this initiative is to provide infection prevention and control education and training to registered nurses and other healthcare professions. And stay tuned for further development on this. We're hoping to have more about this early next month, if at all possible. Next slide, please. I'd also like to say that we've been very strong in our commitment to advancing or advocating on behalf of nurses on the front line as well. Letters regarding aid packages, state resources, PPE, testing supply, staffing, and the work of the administration and coronavirus task force. We have sent a lot of letters, with them or to them, and have spoken with them face to face about the need for more PPE and more testing supplies. As you can see, joint letters to the administration requesting emergency funding and suggesting actions and strategies to help combat COVID-19 as well. We issued a call to action regarding APRN authority and emergency waivers, the federal response to the COVID pandemic, the immediate use of the DPA, or Defense Production Act. We actually called for the president to use it probably, I think, about 6 weeks or so, close to 2 months before he actually invoked that. Also addressing layoffs and furloughs at some of the healthcare teams, securing mental health support, advocating for hazard pay, and also calling for nurses to be present in discussion around the reopening of America. One of our action alerts, the first call generated over 350,000 letters to Congress calling for improved personal protective equipment access. Also, workforce and access to care. After many years of efforts, we also celebrated passage of the Home Healthcare Planning Improvement Act, which was included in the Coronavirus Aid, Relief, and Economic Security, or the CARES Act, which authorized nurse practitioners, clinical nurse specialists, and certified nurse midwives to certify home health services without physician approval for Medicare beneficiaries. We also was included in that was Title VIII Nursing Workforce Reauthorization Act, which is the largest source of federal funds for nursing education. So we were very pleased to see that got through. We also added 70,000 new advocates to the advocacy network. We continue to monitor regularly, changes at the state or national level that impact nurses during the declared emergency, that allowed nurses and others to review the state response and also to act accordingly as well. So we're, as you can see, have been very, very busy up on Capitol Hill, getting a few things done in that way. A couple of other things. Next slide, please. In June, ANA responded to questions from a White House paper that was entitled Preparing for the Next Pandemic. It looked to address future pandemic-based or future pandemic care based on lessons learned from COVID-19 and the past 20 years of pandemic planning. Some of the things that ANA suggested that needed to be done was how the strategic national stockpile could be better managed and how Congress could increase oversight and accountability with that. How states and hospitals can improve their ability to maintain a reserve of supplies in the future and ensure that the strategic national stockpile is backed up and not the first source of supplies during an emergency. We also recommended steps to ensure that healthcare providers and first responders have the supplies that they need, such as personal protective equipment. We also issued guidance on what medical supplies are appropriate for state and hospital stockpiles and inventory program, proposed changes to our public health infrastructure, actually encouraging huge investment in public health, since it has been almost 20 years since there's been a significant investment in public health, and this is strongly needed, in order to help combat the vulnerability of the public when it comes to pandemics such as COVID. And also suggestions for how the federal government can ensure agencies like the CDC maintain an appropriate mission focused on infectious disease in between emergencies, and things that they can do to help respond to any new threats that may come out there as well. Next slide, please. So far we've been talking more about our response and support for the COVID pandemic, but recently also we've been faced with events that have sparked deep pain and turmoil across our nation and the world. And that reminds us of the importance of our rights and responsibility to vote. We bore witness to an act of incomprehensive racism and injustice, and I'm referring to the murder of George Floyd by a white police officer, caught so graphically on video and then abetted by the actions of 3 other police officers. Sadly, his murder, followed by other recent examples of unjustified killings of Black men, women, and adolescents, this has been followed more recently by more tragic examples of excessive force by police in the shooting and deaths of more people of color. These events are a stark reminder that COVID-19 is not the only pandemic that Americans are facing today. Racism is a longstanding public health crisis that impacts mental, spiritual, and physical health. And COVID-19 has exacerbated this crisis and added to the stress in Black and other communities of color, which are experiencing higher rates of infections and death. The underlying factors driving this disproportionate burden of disease are the social determinants of health, meaning the social and economic factors that contribute to poor access to health care and poor health status, including a high incidence of chronic disease such as diabetes and hypertension. So I had the opportunity to share testimony in late May with the White House Committee on, with the House Committee on Ways and Means on the disparate impact of COVID-19 on these communities. we shared recommendations specifically related to COVID-19 and to address the longstanding issues of racial disparity, such as the crisis of maternal mortality and basic access to healthcare, including mental health services. And as I stated, following George Floyd's death, nurses have a responsibility to use our voice to call for change. Our code of ethics obligates us as nurses to be allies and to advocate and speak up against racism, discrimination, and injustice. This is non-negotiable. We're seeing stories of nurses who are taking to the streets with medical supplies to treat protesters that have been hit with rubber bullets or sprayed with tear gas. This is a true sentiment of how nurses are trained to respond, and it is our ethical duty to recognize human dignity and protect human rights. Next slide, please. In June, during our 2020 membership assembly, the ANA's governing body adopted a resolution on racial justice for communities of colors. It reaffirmed ANA's position against racism, discrimination, and healthcare disparities. In addition, the resolution outlines the actions of ANA along with the Constituent and State Nurses Association and ANA individual division division, and it pledges the following. 1, to oppose and address all forms of racism and discrimination. 2, to condemn the brutality of law enforcement and all acts of violence. 3, to champion the code of ethics for nurses, which calls on us to recognize human dignity regardless of race, culture, creed, sexual orientation, ethnicity, gender, age, experience, or any other aspects of identity. And in partnerships with nurses everywhere, we need to educate, advocate, and collaborate to end systemic racism, particularly within nursing. We want to advance institutional and legislative policies that promote diversity, equity, inclusion, and social justice for all. We also want to advocate for the ending of health inequities in communities and healthcare systems that stem from systemic racism. And we want to promote deliberate and respectful dialogue, effective listening, and commitment to change as a means to improve the health of all individuals in the communities where they live and work. And if you want to read more about this resolution, you can go to nursingworld.org and find that resolution. Next slide, please. So what we're saying is that we as leaders, we must come together at the local, state, and national level and commit to sustainable efforts to address racism and discrimination, police brutality, and basic human rights. We must hold ourselves and our leaders accountable to committing to reforms and actions. Remembering the words of Dr. Martin Luther King Jr., the arc of the moral universe is long, but it bends towards justice. And I personally take seriously the responsibility to lead us during these turbulent times. Next slide, please. So given that this is the year of the nurse and a presidential election year, it's important that we work together at the state and national level. Advocacy influences our ability to empower nurses, to promote teamwork and level the playing field, to improve the workplace, to enhance the patient's experience, and also to build healthy communities. We're in a pivotal moment in our society, one that calls for us to listen, that also calls for us to educate ourselves, and it also calls for us to use our influence as healthcare professionals and leaders to educate others, and ultimately to take actions to create a powerful legacy that will be passed on to future generations. Next slide, please. So we've talked about care of a vulnerable population, that being nurses, that being the public. We've talked about the advocacy that we have, but what about the future of nursing? Where is that going to go? Obviously, this global pandemic, it has put the nursing profession on display. Now more than ever, more Americans recognize the importance of nurses and the role that we play. And the ANA has long believed that it is critical to promote the voice and perspective of nurses in the coverage of healthcare issues. That's the short term about this. We want to acknowledge that this pandemic has presented many challenges to us as a nation. The administration and Congress has acted to address the needs of the American public. This includes actions to supply the necessary PPE, the testing that is needed to combat the COVID-19, and emergency funding for hospitals. However, there is an opportunity for further transparency and ongoing actions. We still have the PPE shortage. We still have nurses who are suffering from mental fatigue and et cetera. So there's still a lot of work to be done. And the most important part of this is that nurses need to be a part of these conversations. So opportunities to link back to the top 3 concerns for nurses: the shortage of PPEs, the preparedness or the lack of education, and the cross-contamination and safety of loved ones still remains a priority. And I will say that ANA will continue to advocate on their behalf. We advocate on behalf also of the advanced practice registered nurses to practice to the full extent of their capabilities and their license. And we will continue to advocate after this pandemic is over. We believe that it is critical to life-saving efforts that nurses practice to the highest level of their education and licensing. So we've seen nurses being used in innovative ways during this pandemic, and we hope to see that continue. Nurses are resilient and we function well in times of crisis, as we've proven time and time and time again. Removing antiquated restrictions on advanced practice registered nurses has proven to be an effective strategy to meet the patient's needs during this pandemic. It makes good sense to keep what's working in place. It's also helpful to note that APRNs have full practice authority in 22 states, and we are working, hopefully my state of North Carolina will be number 23 given the next legislative year. But with that, I'll stop, and next slide please is questions, and see if anyone has any questions, or I think we're probably going to go to the panel discussion and then go from there. But I do want to thank you for the opportunity to talk to you a little bit about caring for vulnerable populations and also advocating for the public as well.
Thank you, Dr. Grant, for your leadership in this area and for your comments today. You mentioned questions, and I would imagine we will have many today. I'm listening alongside you all attendees. I'll just remind you to go ahead and begin putting your questions in the Q&A feature. I think we're going to have quite a few, and if you get it in early, that might increase the likelihood we will get to it today. Obviously, the COVID-19 pandemic coinciding with the year of the nurse and midwife has really revealed a lot of work needed to improve treatment and the delivery of care, the care of our caregivers, and advancement of social change. I will transition us now to our panel discussion. We're featuring our 3 nurse panelists. I'll ask each of them to introduce themselves when they begin their remarks. We'll hear today from Dr. Tim Cunningham, Dr. Jeannie Cimiotti, and Ms. Kiah Ford, alumnus, class of 2018. And as they prepare to take the screen, I will begin and introduce Dr. Jeannie Cimiotti first.
Thank you. Thank you very much, and it's such an honor to follow Dr. Grant and listen to the work that the ANA is doing to help us all as nurses. I'm going to spend a few brief minutes presenting some evidence, some of it scientific, some of it anecdotal, on the nurse workforce and COVID-19, a situation that I think of and I refer to in this presentation as a perfect storm. The nursing workforce has issues. There's no doubt about it. There's quite a bit of evidence in the literature and in policy briefs that show that pre-COVID, we had a nationwide shortage of nurses. There's no doubt about it. There's very few states in this country that can say that they don't have a shortage. And some sources project or say that currently we have a need of roughly almost 222,000 nurses a year. Nursing and those outside of the nursing profession are often surprised by this, but it's an older profession. And the average age of a nurse currently, I believe, is in their early 50s. So the experts are telling us that we can anticipate that by 2030, and that's only 10 years from now, that roughly 1 million nurses will be eligible for retirement. There's also some evidence that is a bit concerning, but it needs further exploration, that new nurses are leaving their positions within the first 5 years of employment. Now, that could sound alarming, and maybe it should be, but we don't know why. And this is where we need additional evidence. It could very well be that they're unhappy with their career choice as a nurse, but more likely it is that they're going back to graduate school. So we're losing them at the bedside as they go back to acquire that DNP or PhD. Nationwide, we always hear reports of excessive workloads. We know that from scientific evidence, that 1/3 of bedside nurses report that they suffer from job-related burnout. And that's high burnout, not just, so it's high job-related burnout. And then we have this viral storm that attacked healthcare. And when it made landfall, it caused, for lack of better words, chaos in our healthcare facilities that I don't think we've ever seen before. And one of them being is that healthcare facilities were overwhelmed, completely overwhelmed, whether they be acute care, long-term care, skilled nursing facilities, they were all overwhelmed with illness, with these COVID patients that were arriving in their facilities or that were residents there and developed disease. There are ongoing reports of shortages of staff and supplies. In addition, colleges and universities closed. We had to protect the students, so we closed. And in nursing, we also saw that we had the clinical rotations were stopped because hospitals didn't want students coming in the midst of a pandemic and being exposed themselves. And I read some recent evidence that states that there is a concern nationwide that approximately 14,000 entry-level nurses will have delayed graduation, primarily due to these restrictions that were placed on clinical placements. Sorry about that. And then we have the storm surge. And I'm sure we all remember what happened in New York City. It was horrifying. It was a situation that was actually beyond belief. I know I'm licensed as an actively licensed nurse, an RN and an APRN in New York State, and I received at least 3 or 4 letters, personalized letters from Governor Andrew Cuomo, almost begging me to come back to New York to work. The crisis was that bad. But the agencies, the travel agencies, took advantage of this situation, and they offered incentives that were, frankly, hard to resist. One of them was crisis pay. They would offer nurses, if they signed a contract, $10,000 a week to go to New York and practice as a nurse. Some were offering more. New York State is not a member of the Nurse Licensure Compact, but these agencies found a way to expedite the RN licensure process in New York for nurses. Free hotel rooms. Who wouldn't want a free hotel room in New York City? Free car rentals. I don't know who would want to drive a car in New York City, but that was offered also. Free airfare, discounts and other free offers like shoes and coffee. And a colleague of mine, I know many people in New York City, said there was so much food and items brought to the hospital that they didn't know what to do with them. Now, this was so enticing that you'll see on the left here is a photograph of a group of nurses looking very excited. And they are actually on a plane, Southwest Airlines plane, on the tarmac at ATL. These are nurses from the metro Atlanta area that decided that they were going to go to New York to help during this storm. What they didn't expect was the death and destruction. And you might say, well, why did they go there? Well, there were many reasons why nurses left, and many of them left Georgia, as we saw in that previous slide. Some were furloughed, and some used banked vacation time. You have to remember, nurses that were furloughed, many nurses, not all of our nurses work in acute care. So when the clinics shut down, when same-day surgeries ended, you had a cohort of nurses that really had, for a lack of better words, nowhere to go. So they decided to go to New York. They signed up with an agency, went to New York, but what they found there was horrifying. So first of all, they found unacceptable workloads. Now this takes on many definitions. First of all, you had nurses, registered nurses, who were not trained in intensive care or critical care, and they were placed in intensive care COVID units. So you had nurses that weren't familiar with caring for central lines or ventilators. They were placed in these ICUs. Now, if you know nursing, typically in an ICU, a nurse will have one patient, maybe two. The patient load in New York City was on average 10 critically ill patients per nurse. They worked excessive hours. Now, we all know nurses typically work a 12-hour day, and it's never 12 hours. Till you finish up different odds and ends, give report, it's closer to 13. Well, reports are saying that the hours per day worked by nurses in New York City were at least during the height of the pandemic, 16 to 18 hours shift. They were working many, many days in a row. Some reports 10 to 12 days in a row without a day off. There was constant exposure to death and dying. One report that I read about said the nurse said the most disturbing thing was, and she was not a COVID nurse, she did not work in critical care. She worked on a traditional med-surg unit. She said, was hearing the cardiac arrests that were called every 10 minutes over the PA. I can't imagine that. I don't know, and you could see where the emotional drain would be. Can you just imagine hearing code 99 through your whole shift? Again, as Dr. Grant had mentioned, there was concern. Nurses were stressed about lack of PPE. Some nurses in New York State, their families are saying that nurses died unnecessarily because of PPE. Of course, that hasn't been scientifically demonstrated, but that's what some families are saying. And there was, I think, to me, one of the most important aspects was lack of social support. So I can make these comments because I lived in Brooklyn for a number of years, but New York City is unique to any other city probably in this country. And what makes it unique is that nobody will talk to you. You can walk down the streets and say hello to somebody and they probably think you're going to mug them. Nobody talks to you. In fact, I'd even go a step further, that maybe saying that if you collapsed, had a syncopal episode, they probably would step right over you and just keep walking down the street. So now you have these nurses from the good old South and from the West and, you know, and other parts of the country that are going into a city that they're unfamiliar with. There's no support system for them there. They don't have their family. They don't have their friends. They don't have their colleagues that they see on a regular day. So I think that in itself, along with everything else, adds to tremendous emotional stress and burnout, like I think we're going to see, like we've never seen before in nurses. Now, this photo on the right, a friend of mine, a nurse who had a midline administrative role in a major New York City hospital, who has since resigned and will not go back to nursing, stated that the most disturbing thing she saw every day were the trucks outside of her hospital. Now, those white rectangular things that are on that image are actually refrigerated trucks. So when New York City, when the morgue filled, which happened quite rapidly, all the hospitals had to bring in these refrigerated trucks to house the deceased or the dead. In fact, another colleague of mine who has a young son In his early 20s, he's a member of the New York National Guard, and he had morgue duty. And all he did was stand outside the hospitals in New York City and take bodies out one after another and put them in these refrigerator trucks. So she said of all the things that happened in that hospital, she found that the most disturbing thing, to walk by every day knowing that those trucks were filled with patients who had died. So the aftermath. I've done about 2 decades of research on the nurse workforce, and I am concerned for us as a profession. I think the pain and the emotional distress that nurses are suffering is beyond anything we could have ever expected to see at any time. I mean, just look at the expressions on the faces of this nurses on the right. I feel like I know the nurse up on the top left, Adrienne Johnson. And if you go to her Facebook page and look for a video she placed on April 1st, it will tear your heart out. And these are just clips from it, where she just said she just had to walk outside so she could breathe, that she couldn't get the air, and that patients were dying and everybody was being attacked by the virus. And patients were there one day and she'd come in the next day and they were dead. And that she can't sleep, she can't eat, she needs help, she doesn't know where to turn. And towards the end of this video, she prays. She's asking God to come down and change the situation with coronavirus. So I want to end with the photograph on the bottom left, where nurses are looking a little more hopeful, and to say that we have to help each other. This is going to, I fear that this coronavirus is going to have an impact on the workforce like we've never seen before. So we have to not only advocate for our patients, as we always do, we have to advocate for each other. Thank you.
Thank you, Jeannie. It's been a tough year. It's a tough topic, but I think this is a place to have frank and real conversations about nurses as a vulnerable population. I'll invite Ms. Kiah Ford next to share her screen and share her remarks.
Yes, thank you so much. And thank you all for joining us today for this mindful conversation. And that's exactly what I want to focus my presentation on. My name is Kiah Ford. I am a graduate of Emory University, recent graduate from 2018. So I've got the mindset of a new nurse, and just having completed my first year back in March, when everything kind of got a little bit chaotic. So for my presentation, let's see here, we're going to be focusing on the current space that we as nurses are currently in, and moving forward with that, the essentialness of mind power, some helpful practices that I have incorporated into my daily lifestyle to, try and keep my mind and my mental health in a good space. And then also I want to touch on a few questions as we move forward, both as student nurses, as clinical nurses, as leadership, and how we can better support one another. Alrighty, so as I had stated, recent graduate nurse from 2018, and back in March had completed my residency program here at Emory. And we actually were able to have our graduation right before everything kind of shut down. So, coming into nursing and seeing this really acute and abrupt change in my reality did quite a bit of damage. And like Dr. Grant had said, seeing nurses not able to sleep well, experiencing some symptoms of PTSD, I can personally vouch for that. Coming to work and not even knowing what was going to happen that day. I work on a transplant unit, and, our main population is our transplant patients. But at least for the first 6 or so weeks of the pandemic, Emory had suspended elective procedures and surgeries, including transplants. They were kind of assessed on a case-by-case basis. So we went from seeing 48 beds completely filled at our maximum capacity to only having maybe 12 or so patients on a daily basis. So the need for nurses on the floor drastically decreased. And that meant that shifts were getting canceled. I almost expected to be called at least once a week for one of my shifts to be told I wasn't needed for work that day, or that my shift would be flexed until a later time. If our census had changed, I would be able to come in. I was either floated to our COVID rule-out units or our COVID floors, or to another medical surgical floor that needed some more hands. And so waking up each day for work was really just like, I have no idea. And that just constant uncertainty did such a number to my mental health. So I kind of decided, okay, I can't stay in this negative space much longer. So what are some things that I can do to get out of this funk and to support my mental health? And that leads us to mind power and really trying to practice mindfulness and essentially being present in this very moment. So not anticipating what the inevitable or what's to come in the future. None of us know. And also not focusing on the past. I can't change any of that. So how can I best stay in this moment, give my all of my energy to what I can do right now, and hopefully shaping my actions and my thoughts around that thought. So in a way, it was kind of therapeutic. I would experience those negative emotions of anxiety and fear and anger and sadness and everything that was kind of, compacted. And, I accepted those emotions. Those are all normal and healthy and human, but I didn't want to linger on those. So, excuse me, being more mindful, I acknowledge those emotions and let them go. And a lot of that really helped me to fortify my mental health, and thus by so doing, improving my resiliency, which I think, is a buzzword right now. But I think for nurses, we've been developing resiliency like our whole lives. Non-nurses have developed resiliency our whole lives. I think it's fair to say each of us have experienced some form of trauma in our lives. And those experiences and continuing to push forward all kind of nurture that resiliency. So this is another way that I could do that. And I tell my patients all the time, I see them at their worst, at their lowest, before getting a transplant. I know that this is hard. I know you're tired, but if you can mentally fortify yourself, your body is going to follow suit. And so that was a lot of the thought process I had in really trying to incorporate other practices in my daily routine to help me be more mindful. All right, so one of the first practices I incorporated on a daily basis, because I know we've all heard of meditation, but it's to do it consistently. And it doesn't have to be an hour-long session, cross-legged on the floor in a own mantra. It can be 5 minutes, first thing in the morning after you wake up. And there's so many podcasts and apps to use to make it so much easier and accessible. But it helps me to set my intention for the day. Okay, what am I looking forward to that is a positive aspect? Let me focus on my breath work and the fact that I was woken up today. Like, I think that that thought is beautiful in and of itself. I am not on the other side where my patients are. I'm not in an ICU bed. So let me first set my intention and continue out my day. I've also recently, set some alarms on my phone to remind me, whether I'm at work or at home, every few hours, be mindful. So take a step back from whatever it is I'm doing and take a few breaths, deep breaths, and refocus back onto the intention that I initially set for the day. It might have been, I am peaceful, or I am calm. And just utilizing those few, like that 1 or 2 minutes to do that has been life-changing. And that's not being exaggerating. It really has helped to bring me back to the mindfulness that helps power me through my days. So a few other helpful practices I'd love to kind of briefly touch on. Ayurveda, which is an ancient Indian practice, very much so centered on mindfulness and how you live your life, whether it's through your nutrition, your exercise, your sleep hygiene, and really trying to find balance with your doshas. And I could talk about this for hours, but I'm happy to answer questions later on. But it's really just about how can I really be comprehensive and holistic in terms of my health, and using natural ways in which to do that. And so not necessarily what am I eating, but how am I eating it? Once I started nursing, I would never sit down and have lunch like a normal person. I would, inhale my food because I'm afraid my phone is going to ring. And that's not healthy. So I really had to look inward and really reflect on my natural, like, what does my body do from day to day, and be more mindful of it. Tuning some things, changing some aspects has led me back to being more at peace. Another helpful practice has been therapy. I say everybody needs therapy. You do not need to be at crisis level to engage with a therapist. It's not reserved for those who are, a harm to themselves or others. Of course, we want them to, engage in some type of rapid type of, initiation with a therapist, of course. But for anybody else, student nurses, clinicians, you would be surprised at how much you have to say to someone who does not know you and who is not there to judge you, and who has a constructive kind of viewpoint in terms of how you can better incorporate techniques and tools to better yourself. And then you better yourself, you're going to be the best version of yourself for your colleagues when you're at work, for your patients. And I know Dr. Grant also kind of referenced journaling, and once again, it's wonderful. You can use traditional pen and paper. You can do a video blog. I started doing that back in undergrad, and I studied abroad and would record myself and just my experience, and to be able to look back years later and see the obstacles that I, overcame. I think now would be a perfect time to start something like that, as like a log of everything that we have been facing and, being able to overcome. So I do want to pose a few questions moving forward. And the first being team mentality, and what does this look like to you? And in what way can you yourself change this? Is it, oh, I get along with all of my coworkers? Or, is it, I may not get along with all of my coworkers or may not like everybody, but when I need help, I know that it's there. The next part is active listening. And as a proponent of good communication in all of my, whether it's a friendship, relationships, I think that active listening is something that we as humans may not be the best at, because it requires us to listen without the intent to respond, if that makes sense. So listening and truly hearing someone and their perspective, it might be different from our own and our own opinions, but to listen to what they have to say without, okay, let me jump in and rebut them, I think is necessary. And I think we need this active listening, not only from our upper management and leadership, but from one another. And lastly, our legacy. Dr. Cimiotti, had touched on that, and she's very much so right. What do we do to retain the nurses that we currently have? How do we keep them here? Is it monetary? I know several healthcare institutions lost their financial incentive for nurses because they lost money during the pandemic. Surgeries are a huge moneymaker. If they don't have the money to offer incentives, what can we do? And then for our new nurses and all of the nursing students that are tuned in, one, thank you for, continuing your education amidst the kind of the chaos and the uncertainty surrounding your education. But you're very much so needed. And I guess I would end on this point that, I personally know a couple of colleagues from my undergraduate experience who are either just now enrolling in nursing school or who will be next year. And I think that speaks so highly to our profession. We run towards the fire, so to speak, instead of away from it. And I'm honored and proud to say that I'm a nurse, and really looking forward to ways in which that we can continue to be the #1 most trusted profession. So I will leave you with a couple of resources that I highly recommend if anyone's interested in any of the practices that I mentioned. And if you have any questions, please feel free to email me or ask me in the Q&A following the panel discussion. Thank you so much.
Thank you, Kiah. We're honored and proud to have you as part of the profession and most importantly, part of the Emory nursing family. Dr. Tim Cunningham, I pass the screen to you.
Thank you so much, Carolyn. And it is an honor and a privilege to be able to follow the wisdom of Kiah, the wisdom of Dr. Cimiotti, and the wisdom of Dr. Grant to continue this conversation around aspects of resilience. My name is Tim Cunningham. I'm the Vice President of Practice and Innovation at Emory Healthcare. I also hold an adjunct assistant professorship at our nursing school here. And I'm a trained emergency nurse, emergency trauma nurse for adults and pediatric. I've worked in multiple level 1 trauma centers. And I did my doctoral research in public health, looking at resilience, looking at compassion, looking at what gets us out of bed in the morning, knowing as caregivers, we will face often unpredictable stressors. And as we move into this space on resilience right now, I first want to acknowledge that, as I mentioned, we've all experienced resilience to some aspects in our lifetime, and some people far more than others. When I think of the context in this country, people who have been judged by who they choose to love, what they look like, what they believe in, what gender they are, what gender they identify as, have been forced to practice resilience entire lifetimes. And so when we talk about resilience, it's nothing new. Although I'd have to say in healthcare, sometimes we act as if it is new. And so as I begin this presentation, I'd encourage us and challenge us to think about what are we doing with resilience now in response to COVID-19, and how can we build sustainable, ongoing resilience in healthcare programming for our caregivers forward, knowing that we will continue to see the ramifications of COVID even after we see case numbers subside, and also recognize that what surfaces 5 years from now, we can't predict, but we can build our toolkit. We can support our toolkit and honor each other in that. In our now normal, the image below of what we see or what we should see of people in public wearing masks to protect each other from the spread of this virus. And we know as nurses, our role is to connect, to build meaningful connections, even in the most stressful of times. And that is challenging with a mask in front of our face. That is challenging with a face shield. That is challenging what we're facing in so many ways, the inability to connect. And yet Albert Camus reminds us in his novel, The Plague, a loveless world is a dead world. So not only are we challenged to be more resilient with the work that we do, and by the way, if you've read the National Academy of Medicine report on caregiver well-being, there's a limited amount of information on resilience because there are limited studies on resilience. But one study that's highlighted there in the report suggests that at baseline, we are all born with the same amount of resilience. And yet as nurses and physicians were also in this study, we of course have to build more because of the work that we do, so that we can maintain this essential sense of connection. Now, if you're a reader, when we talk about self-care for resilience, I highly recommend this novel, especially in the face of COVID. I read this novel while I was under quarantine, having treated Ebola patients, and it actually was helpful to me to look at a fictional view of a global plague. And it was curious and frightening at times to see how, in this fictional world that Camus wrote about, we as human beings were experiencing during Ebola, and we're experiencing now, as fear has caused us to retract. As we see, as Dr. Cimiotti suggested, burnout like we've never seen it before. I'd say there's also fear in many ways like we've never seen it before. And I'd also argue and warn that as we look at post-traumatic stress disorder and we look at our colleagues, friends, and family members who are experiencing symptoms of it, that we acknowledge it, that we provide space to hold space for it, to know that the rates are going up, but at the same time that we be careful not to pathologize it or over-pathologize it without considering another side to it, and that is post-traumatic growth. Post-traumatic growth is a concept that comes from psychology literature. Tedeschi and Calhoun, I believe, who are from UNC Charlotte, so part of the UNC family today, developed this concept and looked at ways that when we experience an acute trauma or a chronic trauma, how do we move forward? And I'm happy to say, with my work here at Emory Healthcare, in meeting with nurses, I've had the chance to speak with nurses at 4 in the morning, at 4 in the afternoon, to learn about what they are doing for self-care. I've had sessions where I've sat with nurses and the tears have flowed. And towards the end of these sessions, almost every single one, nurses have told me verbatim, I am scared to death. I am scared to death about bringing this home to my family. I am scared to death, as we've heard before, we don't know what's going to happen tomorrow. And at the same time and in the same breath, nurses here at Emory Healthcare have told me, and I couldn't be more proud. I couldn't be more proud of my team. I spoke with one nurse who said, you know what, when I go home, I'm more afraid outside in public of getting COVID than I am where I'm working, because at least where I'm working, I'm surrounded by people who believe in science, and we're doing everything we can to protect ourselves, each other, and our patients. And if that's not post-traumatic growth, I don't know what is. Post-traumatic growth has 5 elements: personal strength, closer relationships, a greater appreciation for life, new possibilities, and spiritual or existential development. And so as we think about how we move forward collectively, as 4.3 million nurses strong, how can we also hold the space for ourselves and each other to recognize the elements of post-traumatic growth that we're seeing? From an Emory perspective, I think of teamwork. I think of interprofessionalism, and I think of camaraderie, where I've met with leaders who have said, you know what, some of these things that we want to move forward would have taken months, if not years. And all of a sudden, we're able to come together, and over a matter of weeks, we can change our system and aspects in our system so that we can provide the highest quality of care and try to save as many lives as possible. If that's not new possibilities, I don't know what is. Personal strength, nurses I've met with who have said, I never knew I had this in me. Talk about being in the zone. We think about super athletes when they come into the zone. Our nurses are living in that zone. So as individuals, how do we recognize that, support that with each other? And as leaders, how do we build space to help support that and honor that, while at the same time recognizing we are still suffering profoundly? I think of the words that Dr. Grant mentioned. He said, let's keep what's working in place. And I couldn't agree more. And that comes from the new possibilities that we as individuals and teams, new possibilities like using extension tubings to run through underneath our doors so we can keep our pumps outside of the rooms, new possibilities of ways that we're working with telehealth, new possibilities of ways that we as nurses are becoming the family members and the caregivers, holding that phone while our patients take their last breath. Let's keep what's working in place as we move forward. So as we think about resilience, I think it's really, really crucial to say, yes, what are you doing as an individual? Mindfulness, meditation, those practices, if they work for you. We know with self-care and resilience, there are 1 million doors into the same room, as quoted by Dr. Jon Kabat-Zinn. We also know that this is a very self-focused practice. What works for you might not work for everyone else. So there's the self part. but we also have to remember that there's a systems accountability when it comes to resilience. So those of us on the webcast that are in leadership positions, what can we do to carve out time for our frontline caregivers to practice resilience on the job? Because we also know that burnout, like we're seeing, is a work-related phenomena. So what can we do in the work setting to support, honor, and help develop post-traumatic growth? Can we build that sense of grace that we might not bounce back to 100%, but maybe we can bounce back to 70%, and for here and now, that's enough? How do we support that as leaders, and how do we change our systems to continue that support? So we think about resilience, we think about post-traumatic growth and practices that we can do. And another aspect of resilience I'd like to share is one about nurse as historian. Some of you at Emory may recall seeing a video that we published a few weeks ago about a young woman, who was young in the early 1900s, who actually survived the 1918 influenza. Well, why was she honored on Emory's website? Well, because she also just survived COVID-19. And she commented on what it was like to be a part of both of these global epidemics. And I'm sad to say we don't have as many nurses living who cared for patients during that time. And those that are, how can we learn as much as possible from them as we move forward? And at the same time, how do we listen to our nurses from all aspects of care and collect the stories of now, of here and now? How are we managing COVID so that when the next pandemic comes, we'll be more prepared? And at the same time, learning each other's narrative. We know that narrative practices themselves are a form of self-care. So we can actually build resilience while we listen to each other, while we learn from each other, while we celebrate each other and continue to find those new possibilities and the innovations that come from nursing to drive us forward. I'd like to wrap by sharing a photograph of my friend Alice. And when we think about nurses, because when COVID subsides, there is still going to be tremendous work for us to do in working with each other and supporting each other. And storytelling is a powerful way to do that and can continue to carry on our tradition. So I want to share a brief story of Alice. Alice is my colleague. Alice was born in Sierra Leone, which is a small country in West Africa, roughly the size of South Carolina, the state of South Carolina. I met Alice in late 2014 when she and I were working together in an Ebola treatment unit. I was a pediatric nurse where the survival rate for kids was 20% for children under the age of 5. And so, Jeannie, when you mentioned the trucks outside of hospitals in New York, I had to take a breath in a moment because we saw those same white trucks every day, open pickup trucks, full of bodies driving to the cemetery, up and down the roads by the treatment center where we worked. As a pediatric nurse, it was my role to help hydrate the patients that we worked with to try to save as many lives as possible. And it was Alice's role, as one of the only 4 trained psych nurses in the country of Sierra Leone, it was Alice's role to don that horrific PPE and sit in a unit and ask questions and connect with patients. She was the one when a new patient would come in that our patients trusted, so she could help us with contact tracing, to learn the other people in the community that this patient had been in contact with, and to continue that trust and reach out to them and say, we need to quarantine you to keep you safe and the community safe. In doing that work alone, she saved hundreds of lives. At the same time, she was the one that would sit with a child and hold their hand while they looked across to watch their sibling slowly die of Ebola. And she would sit with that child until the child said it was okay for Alice to leave. She was the person who brought news of a loved one who had died in another place. Alice saw it all. Alice did it all. Alice saved countless lives. 2 years after the last known case of Ebola in West Africa, Alice was pregnant with her second child. Alice had an otherwise healthy pregnancy until near the very end, and she developed a complication that needed a higher level of care. Many of you on the phone know that statistically speaking, Sierra Leone is one of the most dangerous countries in the world to give birth. Many of you also know we have states here in our own country that are nearly as dangerous because of access to care. And Alice, after saving countless lives during Ebola, died on the operating table along with her second child. I share this story of Alice because not only is it COVID, it is everything. It is our nursing legacy, as has been mentioned before by our speakers, that is our responsibility to learn from, to carry forward, to honor and respect our mentors who put us where we are so we can continue to provide stronger and better care. And Jeannie, I'm going to go back to your words, burnout like we've never seen it before. I'd argue that we're also going to see resilience like we've never seen it before. And I want to close with, we need to see the advocacy on all levels as nurses like we've never seen it before. Thank you all so much for your time, and for all of you as nurses for walking into the fire that we can make this world a better, safer place.
Thank you to my colleague, Tim, for those uplifting words. We've been through a range today. I can't help but think how fortunate our nurses at Emory Healthcare are to have you sit with them and talk through some of these things. We are also fortunate to have you as one of our co-hosts of the Nurses Station show, and I'm so glad. I'll invite all of our panelists to turn their cameras back on. We have a few questions. We've tried to go through them. I apologize in advance if we don't get to your question. Like I said, like I expected, we have quite a few here in the Q&A. Our first question is for Dr. Grant, and this is from Krista Irwin. Mm-hmm. My sons and I have participated in several Black Lives Matter marches in Atlanta this summer, and at the latest one earlier in September, my son and I were arrested for obstructing traffic and walking in the roadway. I was walking with my medical bag and may have been targeted. Are there any recommendations or agreements made by the ANA or other nursing organizations with government agencies based on acting as a medical provider that may help in my defense of these charges?
Thank you. That's a really great question, and I'm sorry that you were arrested. I am not familiar with any contractual relationships that, well, I know we do not have any. Usually what happens is that if nurses are planning to either man a first aid booth or something like that, they call the local police department where the protesting may be taking place and say, we're going to be there, we're going to be identified by, the type of clothing that we're wearing or, whatever else, but just so you will know that we are there. And there's an implied understanding regarding that. But in this particular situation, I don't know. You might want to check with, I don't know if you have an attorney, but have the attorney to check and see if there's anything that, or any type of agreement or whatever that may be in place, and to specifically specify that you were there, providing medical care, and should be able to hopefully be forgiven for that. So for the arrest.
Thank you. Jeannie, our next question is for you, and it comes from Ronnie Jowers. I know sometimes when we know that these truths are the lived experiences of nurses that can be very difficult. And there's some reluctance, I know, to share, partly because we're concerned about putting that out there into the public when we are experiencing a shortage of people going into the nursing workforce. And this is Ronnie's question, which is around the nursing shortage and how well we're preparing to address that shortage, in particular in light of what the public is potentially reading and seeing about some of these challenges. And I'll begin with Jeannie, but other panelists here, please join in if you'd like.
Well, I think we definitely have enough nurses coming into the profession, young nurses, if we can overcome this little bit of a bottleneck that we had at the clinical placement. But we are definitely going to lose them because of retirement age. And the fear that I have, and I've seen some people I know, and this goes to New York, and I know New York was an exceptional situation, but there are people that I know who were nurses in New York that just resigned, and it wasn't that there was retirement age, they just said they couldn't take it anymore. And I think what we're going to find are some states will suffer more than others. I fear for us here in Georgia, because we allowed many of our nurses to go to New York, and to begin with, Georgia is one of, as far as number of nurses per population, we're ranked one of the lowest states in the country. So we can't afford to lose nurses here. Other states will do well. One of them being California. California nurses are attracted to California because California has legislation that mandates the nurse to patient ratio. Now, I don't know how they were coping with that during COVID, or if there was some kind of reprieval from the legislation during this pandemic, but nurses typically want to go to California because they know that it's the only state that has unit-specific staffing ratio. So that's where they like to go. I think the rural areas will suffer. Excuse me. Nurses have a tendency to gravitate to cities, especially new nurses. They all want to be in the major, metropolitan areas, the big trauma centers and such. So I fear for our community hospitals, especially those in the rural areas. And I just pray to God that, like Tim and Kiah had said, we have to make sure that we embrace our colleagues at the front line and support them, because we can't afford to lose them. We can't. And like I said, I know for a fact there are people that I know that were not near retirement age, New York City nurses, and they left and they're not going back. Now that just could be, that's New York City. I mean, we saw them on the news every night, and they had a situation like no other city in the country. But I think we have to be cognizant of what could happen, and we have to promote this wellness and such that was mentioned. And nurses have to remember to take care of each other. If they can, aside from everything that's going on, care for each other at the front line, I think we'll be okay.
Caroline, if I could add to that too, thank you so much, Dr. Cimiotti. I totally agree. And one thing that we have in front of us too is, I'll call it a COVID momentum. And in this space, as we see decreasing case numbers at this time, knowing that they're likely to increase again, we still have that drive of the meetings, of bringing teams together, of what my ER mentor, Bob, told me years ago when I was a new emergency nurse. We didn't have somebody, he said, Cunningham, improvise and overcome. And we've been doing a lot of that. And so when I think about how do we improvise and overcome now, one is, can we look closely at hours? Can we build more flexibility in nursing hours, which can leave more time for rest, also leave more time for our nurses who have kids who are now at home and school? So can we continue to be creative around that? Can we continue to look at team models? Some of the most innovative work that came early on in the pandemic was the ICU team models in working with technicians and working with APPs at the top of their license. Can we help keep that moving forward to reduce some of the stress and workload? And from a burnout perspective, we know that a loss of a sense of autonomy can also lead to symptoms of burnout. So how do we continue to support a sense of autonomy as we do this work? And maybe also health systems should look at nap culture. Maybe there's a possibility to change break rules and nap rules to say, we'll hold space for you here because we want you to be your best self. And I would just hope we can maintain this momentum from a policy level and continue to make bold choices that push against the grain of traditional practice.
And, I'd like to also add, and I feared that maybe my talk was a little bit too negative. I'm just fearful for the workforce. But one positive thing, and you talk about resilience, it doesn't take a lot. It doesn't take a lot to build it. And my friend who was horrified just walking by those trucks every day also said to me, and she had different work hours being on administration, when I would leave, when I'd be here late and I would leave at 7 o'clock, it was the best feeling in the world, because I'd walk down the street and everybody was clapping for the nurses, from all the condos and everything and all the buildings on the street. You could hear them clapping. And she said she would get her phone out and show it to me. And she'd say, look at how much they love our nurses.
Mm-hmm.
Dr. Grant, I'll go back to you about how we build on this COVID momentum. This is a question from Sandy Dunbar, one of our associate deans. How will the ANA plan for post-COVID recovery of nursing issues? For example, how do we capitalize on the disruptive innovations that have been afforded nursing in terms of leadership and teamwork, and deal with the destructive things that have emerged with stress and the impact on nurses' health?
Well, two things. One is we're continuing to advocate for, during at the beginning of this crisis, declared an emergency. So, that, as I mentioned, APRNs were able to, to do more. And of course, we have telehealth, telemedicine, and et cetera. And one of the things that I had the opportunity to do was to meet with the Secretary of Health and Human Services, Azar, and I served notice to him and said, we're not going back. And, we have proven if we can do this during a crisis, then, and we've proven that we've been able to do this, why can't we do it under normal times? And plus you have 22, states that are already doing this anyway. So, and he's in agreement. And so one of the things I'm going to try to do is elicit his help, either through a letter or a statement or something that as we go and challenge full practice authority and the rest of the states, that will have his backing. So it's going to take all of us working together to, to say that we shouldn't be able to, if we can prove that we can function like this under stressful situation, we should be able to function even better under non-stressful situation and achieve so much. Look at how the public is loving telehealth, telemedicine, and et cetera, as opposed to, having to stay home, not go to work, take the 4 hours to perhaps go to an appointment, wait in the waiting room, and then come back and, and all this, whereas they can just have a 15-minute, telehealth visit, and they feel perfectly fine with that. So that's something that we can do. So, and getting nurses together to champion this cause is going to be one of the other things. And of course, we also have to get the public involved as well, because those are the ones that the politicians whose minds you got to change. They're the ones that are going to cause that influence. It's, right now the politicians are looking at nurses with no money, if you will, and physicians with deep pockets, or the medical society that can fund their campaigns, their reelection campaigns. And the only power to that, to counteract that, is if they hear enough from the public saying, I want my APRN and or clinical nurse specialist to be able to do what it is that they have been trained to do. And that's what they're going to, finally listen to, because they realize the public votes, especially seniors.
Yes, I've been delivering telehealth primary care to seniors from this seat for about 6 months now.
Yes. And they love it.
Yes. Our next question is from Britt Barron, and it's a question about potentially how nurses might be able to engage in this more effectively, which is, do you envision a time where nurses are nationally, and my screen just moved. Bear with me. Oh, there it goes. Nationally credentialed, essentially, as opposed to state by state. And if so, do you think that they could be more effective as advocates?
I guess that's directed to me. Yes, I do foresee that that may be coming down the pike, and it's again, it's a matter of nurses working together. In a conversation I had earlier with some of the faculty, that a question like that was sort of brought forth as to we're all in our little silos, if you will, and we want our little slice of the pie and forget about the other guy. Or like if I'm a APRN and it's like, okay, I got mine, it's up to you to get yours, and et cetera. We got to realize that we all have to champion the cause together. And even though you have achieved yours, now is your time to, to help someone else, get over the line and have that trickle down effect. And so many times it's, it's just as I described. I get mine, so I'm satisfied, and I'll sit back and let everybody else continue to fight for theirs. And that's not how how we're going to make progress. We all have to champion together. We are, if you got 4.3 million people, that's, that's nothing to sneeze at. If I'm a politician and a lawmaker and I have that many people coming at me, I am definitely going to be listening to what they have to say.
Absolutely. Kiah, this question is directed toward you. One of the things I wondered about was what resources you were drawing upon to identify the need and then some of the mindful practices that you've embraced. We have a couple of questions specifically about how students can be involved in any and all of these efforts and new nurses. I did want to ask if you maybe picked up some of these in your nursing education, but it's okay if you don't say that.
Well, I will say that after kind of going through the first few weeks of just feeling overloaded with all the policy changes and the information and all of that, I said, we're not going to do this. We're not going to stay in this negative space. So my best friend, actually, she's wonderful and she's a yoga instructor, and she directed me toward an app for meditating. And so that's kind of the jump start that I took. And then just various resources after, Google, some friends that I have who are also kind of also within like the holistic healing type of environment recommended Ayurveda. Therapy was always something that I wanted to try, but didn't think I had the time to find a therapist and kind of vet them and, figure out if we really had a great bond. So I think it was a lot of just my own personal, I can't be in the negative space and it'll swallow you. Even going to work and you're constantly surrounded by negativity. A lot of people are scared. A lot of people have anxiety about it. A lot of people might be angry. And so I'm very transparent in believing that energy just kind of flows very naturally from person to person, and negative energy being more kind of contagious. And so I needed a way to fortify myself. So to our students, I think that there are so many different resources that you all can utilize. And as you're getting into those clinical placements, really bringing what you do in your own time at home and bringing that to your patients, they can tell. Our patients always can tell when we're feeling our best and when we're not, and they deserve us at our best, and we deserve ourselves at our best. So I say if you're feeling like you're kind of stuck in a negative space, just start to do some research and see what else is out there to help you bring you back to that more positive environment.
Could I follow up on that? I so appreciate what you're saying. And I think, I recall in one of our planning calls, you said you're a second degree nurse or this is your second profession, right? Oh man, when I think about what you bring to share with your patients, in my own experience as a second degree nurse, and also having taught second degree nurses and worked with them, bringing those aspects of who you are authentically, not only can help build that connection with the patient, like you're saying, there's evidence that says that builds joy and resilience and fosters compassion in yourself. So, I think that as a way to do that. And then how do you connect with your colleagues so that, like you're saying, that energy can flow and move between people? I think that's spot on. And I'd encourage, as someone who gets to work with our new residents and help support our residency programs, also reach out to folks like me here at Emory to let us know what you need. I think a change in nursing education that I've seen since I've been in nursing education is that the student voice is louder and louder for all the good reasons, and keep it coming because we got to learn from you all. So thank you for guiding us.
Thanks, Tim. On that note, I just want to thank everyone for attending the 2020 David C. Jowers Lecture via Zoom. We specifically thank Dr. Grant, who has generously spent his entire day with us. Now, this is the time we historically would present Dr. Grant with a special gift from the School of Nursing. Again, for our longtime attendees, I don't want you to worry. We did ship something to his home today.
Yes, I got it just this morning, and thank you very much. It's a very nice journal with my initials on it, as well as cups from the School of Nursing. Hadn't opened the envelope yet, but we'll do that too. So thank you all very, very much. I have had an absolutely fantastic day. I'm going to be hoarse for the evening, but it's invigorated me just tremendously, and some wonderful ideas exchanged, and I am just absolutely astounded. So
thank you so much.
Thank you.
For our attendees, a recording of today's speakers will be made available in the coming days. We'll be offering continuing education credits for those who are interested, and to get those free contact hours, please complete the evaluation that will follow via email to all attendees. This event and a range of other continuing education courses are available on our Emory Nursing Experience platform, which can be found at ce.emorynursingexperience.com. Now, while we don't have the opportunity to reception together this year, on behalf of the Nell Hudson Woodruff School of Nursing, I look forward to being with you in person again someday. That wine and cheese will taste all the better when we're together again. Thank you all again for your attendance and your attention. Stay safe and stay well, everyone.
Thank you, everyone.
Bye-bye.